pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanotoo on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School.
Hello, ladies and gentlemen. Once again, it is time to come your way with the Online Pregnancy School. It is always a pleasure to come your way with interesting, educative, and important topics on what can be done during pregnancy and even childcare for us to have a reduction in the preventable maternal and newborn deaths. Just to remind us that around the world every day, over 800 women die because of pregnancy and related complications. And we have over 7,000 babies, unfortunately, also being born dead. But some of these are preventable. And that is why we come your way with Online Pregnancy School, so that we'll learn more about what we can do as pregnant women or as husbands, as sisters, as brothers, anybody at all to help to reduce these preventable deaths. My name is Dr. Linda Vanotoo, and if you have not yet subscribed, please go ahead and hit that subscribe button. Turn on the notification bell so that anytime we are coming up with a program, you'll be informed and you will join us. Please join us and share with friends, share with family. Don't just take it that, oh, the Online Pregnancy School is on, let me join. No, get somebody else to be involved. Get as many people as possible to join us. And you know what? We are 1 year old. Wow, we thank God so much for what He has done. And in our previous session, we spoke with somebody who has joined us on many of our programs, and he shared with us what he has benefited from all the sessions that we have had. And because he's a pastor, he's able to share this with his congregation, some of his pastor friends. And I want you to do exactly that. Share. Go ahead and share. And on Facebook, follow us on the Pregnancy School. Today, we are going to look at another aspect of what we can do to help us stay healthy whilst pregnant and also have healthy babies. And I'm going to talk about alcohol. We have had a session on alcohol use, but this time round, we had a question that what happens to the baby? So we want to take that today and address alcohol use and its effect on the baby, whilst the baby is in the womb and after this child is born and even into the child's future. But let me just say that people drink alcohol for various reasons, and some pregnant women also take in alcohol for various reasons. But please, whatever you do, do not use alcohol as an appetizer or as a way of feeling better because of how you are feeling as a result of the pregnancy. No. And that means that alcohol used during pregnancy is not acceptable. It is to be avoided completely. No time during pregnancy is alcohol acceptable, and no amount is acceptable. So during pregnancy, please, as a pregnant woman, do not take alcohol. Some people may be taking alcohol without knowing that they are pregnant, especially at the beginning of pregnancy. But as soon as you get to know that you are pregnant, please stop drinking alcohol. It is important, and we'll know very soon why it is important. When a pregnant woman drinks alcohol, this alcohol travels through the mother's blood and then gets into the baby's system. You know that we have the placenta, which links the baby to the mother through the umbilical cord. So when a woman drinks alcohol while she's pregnant, it will pass through her blood, pass through the placenta, pass through the cord, and get into the baby. And the effect on the baby is even worse than the effect on the mother. Because remember that this is a young child growing, a lot of things are happening. So when this alcohol gets into the system, it affects the whole growth and development of this baby whilst the baby is inside. And unfortunately, a lot of the effects cannot be reversed when the child is born. a lot of them, almost all of them, they are irreversible. They cannot be changed. You cannot change them to become normal. So it is important that we understand no alcohol is acceptable anytime during pregnancy and even in the smallest quantity that you can think about. Unfortunately, we have a lot of women who even know that they are pregnant but still continue to drink alcohol. And it's a lot. But please, you wouldn't want to have your child coming into this world with what we are going to talk about. If you have not yet subscribed, please go ahead and hit that subscribe button and turn on the notification bell. And also follow us and like our page, The Pregnancy School, on Facebook. So what happens when this woman drinks alcohol? And I'll start from when the baby is inside the mother's womb. When the baby is inside the mother's womb and the mother takes in alcohol, as I've said, it travels into the baby. So that takes place. And because this is going on whilst the baby is also developing, it affects the child's growth and development inside the mother's womb. So you find that this baby's growth will now be retarded. Inside the womb, the baby will not grow as well as he or she should grow. So it becomes smaller than the age of that pregnancy. Another thing that can happen is that if this continues and it's quite severe, then the mother can even lose the pregnancy. She will have a miscarriage because of the alcohol that this mother drank. So the baby can become very small and the mother can also lose that baby. Now, because the brain is developing throughout the pregnancy, and even for adults, you see somebody who has taken in a lot of alcohol, look at the way this person behaves. You realize immediately that the brain has received quite a lot of the alcohol. And this is exactly what happens to this baby. So inside the womb, when the mother drinks the alcohol, it goes into the brain and it affects the brain development. So what this does is that it interferes with all that the brain should be able to do whilst inside the womb and as the baby is born. So it will affect the brain, the development, and how it should function when this child is born. So that is another thing that happens inside the brain when this baby is in the mother's womb. Now, another thing that happens is that the baby, if it is not aborted, can go on and become a stillbirth. Stillbirth and a miscarriage both are describing the loss of a baby, and this baby is not alive when it comes out, but it is because of the age of the pregnancy. So early on, it is called a miscarriage. Later on, this baby can be born dead. The baby comes out, maybe develops to quite a stage where it would have survived if it did not have any other challenge. But then this baby is born dead. So inside the womb, what happens is that when a mother drinks alcohol, then this mother unfortunately affects the growth of the baby, affects the brain development of this baby, and then the baby can be born dead. That is not good enough. Now, when this child is born, what happens? At birth, the baby may have difficulty sucking the breast because the brain did not develop well. There's poor coordination. The baby cannot put the thoughts together. So you find that this baby, unfortunately, it is born, but is not able to suck the breast very well. Another thing that happens is that the head becomes small. Now, the brain, as it develops, needs space to expand and grow well. Now, because the alcohol is affecting the growth of the baby whilst it is inside the mother's womb, the head can become small. Once it is small, it means that the brain will not have enough space to expand to the level where it should. And this, again, will affect the mental state of this child. And then again, when this child is born, it will have challenges with sleep. So the child is now not getting the alcohol, and this child has a lot of brain damage. The brain did not grow well, and the child is also unable to sleep. So at birth, you find that the child has these challenges, which I have mentioned to you. Now, another thing that we are going to talk about is as the child grows, what happens? Now, when the child is growing, you find that the child, because it did not grow so well inside the mother's womb, would have low stature. The child will be shorter than should be for the age. The child is small because of the poor growth. And unfortunately, the child becomes very, very, very active. We call it hyperactivity. Sit here, the child cannot sit there. Do this, the child cannot do that. Very difficult to control in terms of trying this to get the child to do things. It is very difficult. Another thing that happens is that the child has difficulty with attention, cannot pay attention. Already the child is not even staying at one place, so has challenges with attention. To say that I'm doing this, pay attention, no, the child doesn't have that. So that becomes another challenge that you find when this child is born. Another thing is that because of all these and the fact that the brain did not grow well and the child has this mental challenge, learning becomes a problem. So if you send this child to school, it will be a big challenge for the child and also for the teachers, because one, the child will not sit still. Two, the child is not able to pay attention. And three, the child is not even understanding what is being taught. So you find that all these put together makes it very difficult for this child to pay attention. Another thing is that the speech, the way the child speaks, the speech and hearing are also affected. Because the child cannot hear well, it cannot also speak well. And that affects this child's growth and development, because we find that as a child is born, definitely this child must grow. And as a child grows, there are certain things that you expect the child to be able to do. So if a child is 6 years old, you wouldn't expect that child to behave like somebody who is 2 years old. But unfortunately, when the alcohol gets into the child while the child is inside the mother's womb, this is what happens. So the child is not able to behave the way you would expect the child to behave for that age. We get that right? Ladies and gentlemen, if you have just joined us, today we are talking about alcohol use and the effect on the baby. We have spoken about what happens when the baby is inside and the mother is drinking. The alcohol goes straight to this baby. And so the baby is drinking and the effects are more severe than you find in the pregnant woman. The pregnant woman may not even show any signs, but this baby, remember, it's a tiny baby growing inside, and the effects are just unpleasant. And again, I have said that the effects on this baby as the child grows are irreversible. You cannot reverse them. Another thing that happens to this child as the child is growing is poor judgment. The child cannot even understand a whole lot of things, so cannot judge properly as to what is happening. So you find that this child has poor judgment. That is not what we are looking for. We are looking for healthy babies, babies who will go through the mother's womb and come out healthy. And this is why this is preventable, and I'm calling on you to join me. The other thing that this child will suffer from, poor vision. You see, inside the womb, the baby starts as a very tiny thing. And then as the days go by, as the months go by, the child develops gradually. And at every stage, there is something that is developing till the child gets to the stage where now he or she can be born. If anything disturbs any process along the line, the effect will be seen in this child's life. So the eyes, if at the time of developing, where the nerves should have gone and everything should have come together beautifully for this child to see, and the alcohol went in at that time to stop that process from going on, then this child will be born with challenges of poor vision. The child cannot see well. Another thing that can happen is that you may not see it, but it will be there because the effect will be seen. The heart, the lungs, the kidneys, all the things that are inside, the liver, everything can be affected. And all these will show when the child is born and is growing. So there are some of the effects that take place while the baby is inside, like the miscarriage, or when the child is born as a baby and as the child grows. Unfortunately, these effects continue even into adulthood when the child becomes a grown up, an adult. And some of them will be difficulty relating because of the behavior. Who wants to play with this child? Now, as the child grows, it even becomes worse because this child realizes that I'm growing up, but I cannot even have friends. So that becomes a problem. And then you have someone who is maybe 18 years, 17, 20 years, behaving like a child because of the brain damage that this child suffered as a result of the alcohol use when the mother was pregnant. So you find that psychologically, it will be a big problem for the family. So even though it is one woman who drank the alcohol, the effects are not just on this woman, but on the child's future. It means that the whole future of this child is in jeopardy. The child is going to suffer all these things that we have mentioned. Can you imagine a child growing up with all these, in addition to the issue of not even being able to understand, to go to school, to learn something for himself or herself? That child will be your responsibility because that child cannot take care of himself or herself. So you find that alcohol use, people may not be aware of, but the effects are serious. Now, when a woman drinks the alcohol during pregnancy and the child is born, it's been observed that around the world, when you take a lot of women, maybe out of 100, you may have close to about 10, 20 drinking alcohol for various reasons. And the effects are severe, as we have spoken about. So researchers found that these children look in a certain way, and all these things that I have mentioned as they suffer, they have put all of them together and called fetal alcohol syndrome. They have different names, but fetal alcohol spectrum disorders, syndrome disorders, it's a range. So you can have a child having not all of them, some of them, another child will have some of them, one will have, but they will have some of these features that I have mentioned. And when they are born, they have a certain kind of facial expression that makes it possible for diagnosis to be made that this child may be suffering from the fetal alcohol syndrome. And you find that the space between the upper lip and the nose is flatter. They have the bridge little flatter. The ears are a bit smaller. The face looks different than you would see in a normal child. And this helps to make a diagnosis that this is what happened during pregnancy. So we are using this forum to also encourage our midwives to talk to pregnant women when they come for the antenatal or when they come for the pregnancy school, that alcohol use in pregnancy can affect the life of this child forever. If this child doesn't die, this can be a big issue for this child going forward. So they should resist alcohol. Just do not take alcohol during pregnancy. As soon as you know you are pregnant, if you were drinking, please put a stop to it and let us have healthy babies. Ladies and gentlemen, if you have just joined us, we were talking about alcohol use in pregnancy and the effect on the child. And I said that all the things that happen to this child is being put together called fetal alcohol syndrome disorders. Fetal alcohol syndrome disorders. Some people want to call it fetal alcohol spectrum disorders. So it is a range of things that can happen to the child from the head to the toe. Because some of them have smaller limbs as well. You see that the hands are smaller, the feet are smaller. So you see that from head to toe, something shows that this child drank alcohol when it was in the mother's womb. If you have not yet subscribed, please go ahead and hit that subscribe button so you know anytime we are coming up. And if you have questions or comments, please put them in the comment section and I'll be very happy to come back and answer them for you. And if you have any topics that you want us to discuss, also go ahead and share them with us and we will gladly come back and discuss them. This particular topic we are discussing today It's an answer to somebody's question about what happens to the baby when the mother takes in alcohol. And I hope that that person has listened in today and has also learned a lot and shared with others. So I want to leave you with this, that alcohol use in pregnancy should not take place. No amount is acceptable. No time during the pregnancy is acceptable. And if you are doing this, please know that the effects are lifelong for this child. And it is not that child alone who is going to suffer, but the mother, the father, the family, everyone, because it is a lot of money taking care of such a child. As the child grows up, as the child becomes an adult, this child will be still your responsibility, and it will be a big drain economically, psychologically, socially for you as the parent and also for the child. So let us help pregnant women not to take in alcohol. Let's join her. Let's join them. Let's share this message that as a pregnant woman, please desist from alcohol, because we do not want to have fetal alcohol syndrome. We don't want to do this. I hope you have enjoyed today's session and also learned a lot. Don't forget, if you have not yet subscribed, please go ahead, hit that subscribe button and turn on the notification bell so that anytime we are coming up with another program, you'll be informed and you will join us. See you in my next video. Bye.